Being committed to patient-centered care has driven success for Constellation over the last 15 years. Our complete care at home approach was designed with the idea that if we provide the patient and their families with all of the tools and the resources that they need, they will be able to remain safely in their home and out of the hospital, which is where they want to be.
Success is really about the partnership with the employees and the community.
It's not enough to just do a visit and see a patient. It's how you do the visit, the smile, with the love, with the care.
One of the things that Constellation is able to do is to really help and support elders in the community. And we really are a full post-acute continuum that allows people to stay safe in their home, in the community, long-term.
With the amount of education that we are out doing, between nursing homes, churches, and community events, really meeting people where they are just to answer questions, it's amazingly well received.
Constellation truly embodies patient-centered care. We take it very seriously, identifying what their primary goals are, working collectively as a team.
It's always a nice feeling to have somebody come back to Constellation and request me.
Most of my patients are geriatric, and I try to make sure they recognize me. So I added pearls to my attire every day, and so they might not know who I am because of my hair that day or my scrubs, but they always know who I am because of my pearls.
I had a home patient, and because of his illness, he couldn't stay up to watch the games. He kept falling asleep. His spirit really dropped. He didn't want to go on. Everything else had been reduced for him, and now the Red Sox. When I told him that the game is repeated the next day at noontime, and he started watching, he wanted to go on. His spirit really lifted.
When New York came to a standstill, the administrator, the supervisors assisted us to get all these cases up and running. That was special and very rewarding.
For me personally, it's very exciting that we have the pediatric piece with the school-based therapy, the school ABA and the home ABA. We always had occupational therapy and physical therapy. More recently have added the speech and language therapy. The school-based ABA division is also part of the school-based therapy team now. So we've continued to grow.
We have that human touch, that cohesiveness, and that will continue on as we grow up and down the East Coast and throughout the United States. This is an unbelievable company, and it can only get better.
How many more lives can we potentially change in a positive way?
I think the next 15 years will be very exciting.